Welcome back, ladies and gentlemen. Now with our main topic today, we're discussing today the variant of the COVID-19. We're going to know more about it. It is called Stratus. And to shed more light on this, we have the pleasure to have with us over in our studio our dear guest who is with us today, Dr. Islam Anan, Health Policy and Health Economics Consultant. Good morning.
Good morning. Always happy to be with you.
Thank you so much. It's my pleasure. Dr. Anan, give us an idea. What is the variant of the COVID-19? What are the symptoms of it? How does it differ from the COVID-19?
Okay, so to start currently...
Yes, first it's called...
Stratus.
Stratus, okay.
That's actually the nickname.
So it's not the Nimbus?
The Nimbus was actually the previous variant.
Yes.
It was actually prevalent and dominant in January.
Yes.
And currently it got replaced, and the circulation currently is from Stratus.
Yes.
And just to give the audience an overview, when we are talking about the COVID variants, we are still talking about Omicron. If you remember, 3 years ago we got a variant called Omicron. So far all what we have currently are actually the variants and sub-variants of Omicron.
Yes.
So every season, because we do have 3 seasons every year for COVID, currently we are in the middle of a wave, there is another variant circulating. So the previous one was Nimbus and JN1, and currently we do have a Stratus. And the thing about Stratus that it was circulating around 11% only worldwide 1 month ago. Currently, while we speak this week, it's actually around 40% of all cases. So we are talking about an significant incremental increase in infections in the R node, which is the infection rate, and hence it's currently the most dominant subvariant in the world. Yes. However, it's still a variant under monitoring, not of concern. So to give an illustration about that, WHO, the World Health Organization, they define variants as it's a variant of concern. There's a big concern about it because it actually increases mortality, increases morbidity, which is hospitalization, or it's just under monitoring. We don't know yet what's actually going on with this variant. So when we are talking about XFG, which is the Stratus one, it's still under monitoring. So hopefully it will not going to be actually
under
worse.
Control, you mean?
Under monitoring.
Yes,
so
monitoring.
Still monitoring the status of it worldwide, and the symptoms, because all the time we are faced with the question, is it different from the previous ones? So it's more or less the same. We still got the loss of smell, the loss of taste, but slightly less than the previous variants, and we do have more gastrointestinal symptoms. So diarrhea, gastric upset, all of these are actually GIT, gastrointestinal symptoms, which is more heavy with the Stratus. We do have, of course, the fatigue, the chronic fatigue syndrome, which is even going to be continuing after the remission as well.
Yes.
The fever, the numbness sensation, the feel that I would like to sleep more, the hydrophobic, I don't want to drink more water because I got sore throat. All these are actually significant symptoms of it, plus, of course, the usual one. However, for us, it doesn't matter the symptoms to identify which variant it is, because eventually the treatment will be the same. We treat symptoms. As long as it's a mild to moderate infection, we're going to be treating symptoms, and that's it. If it's actually moderate to severe, we are talking about, for example, a diabetic patient, hypertensive patient, patients who are actually immunosuppressant, or taking immunosuppressive medications, healthcare professionals. These 5 categories, they need to seek medical consultation immediately, because they need another protocol, not only treating symptoms. So these are actually the symptoms and the overview, the general overview of it.
Yes. Dr. Anan, how is it circulating or spreading in the summer? Because we know that the virus dies in the summer. So why is it?
That's a very good question.
Thank you.
It's a mess, because I've heard it a lot. During summer we don't have flu and we don't have COVID.
Yes.
But actually we do have flu and we do have COVID, but we do have more viruses circulating during summer than winter. We got winter viruses and summer viruses. However, every year we got a wave of COVID during this month.
Yes.
So last year we had it as well in June and July, this year as well. So we do have a stagnancy currently, a plateau phase in terms of increase week after week. However, this month on a global level, we do have an increase in infection worldwide.
Yes.
Of course, not all the countries are reporting like before. We got only 99 countries worldwide reporting COVID cases, and the rest actually make it an obsolete mechanism to record it. However, this month we got a surge in hospitalization, for example, in UK, in the United Kingdom. So there is a flare, and there is actually an emergency alert because we don't have any increase in symptoms in terms of severity, alhamdulillah. So there is no increase in severity. However, because we got more spread of the virus, we do have more people entering the hospital and more admission.
Yes.
So a very important point to say, it's not more severe than the previous variants, and it's not actually escaping the vaccine heavily. It escapes the vaccine, but in a slight way because of the mutation it got.
So it's not that dangerous?
No, it's as dangerous as the previous variant, but it's more circulating.
Let me ask you, can we say because it's more circulating and it's spreading fastly during the summer, do you think that it could be a global pandemic?
We're not going to reach. We're not going to reach a global pandemic. So yes. So we can rest assured that so far we got the pattern of COVID, and so far we got a good herd immunity worldwide. So currently we do have a mild Omicron, although the circulation can be more significant. We do have still waves, 3 waves every year, but still we're not going to be reaching a global pandemic, inshallah. We can expect another virus maybe in 10 years, 20 years, but not from COVID. We got
Doctor, when did it start actually and started to be transmitted?
How it started, well, when?
Yes.
How?
When and how did it start?
Yes. So if we're talking about stratus, so the virus mutates all the time. So every year we got a new variant. The mutation happens because the virus is actually aiming to continue its circulation. So it changes the protein on top of it, so it will be actually more infectious. So any virus worldwide, any virus would like to mutate to be more infectious and slightly dangerous, not more dangerous, because they would like to continue to survive. If they are actually killing their host, they're not going to survive. So that's what's happening with COVID. It mutates all the time, and it will continue to mutate. So next year, expect a new mutation, expect a new variant.
Yes.
However, not a more dangerous one. So it will be exactly the same.
Yes. Doctor, can it be easily detected in the international airports, for example?
Okay, so far we don't need to do that. It can be easily detected using the same methodology we've done during COVID days in the 2020.
The quarantine, yes.
Yes, exactly. However, we don't need that because if anyone got fever, they are actually measuring temperature. But is it from flu? Is it from RSV? Is it from COVID? It doesn't matter. As long as it's a viral infection, you need to be treating the symptoms. It's not like before where actually we need to isolate COVID people for around 3 weeks till we're actually making sure of remission. Currently, they need to isolate themselves for 3 days.
Yes.
They got infected. And the most important thing is, if I do have in my household a senior citizen, an old ager, we would like to take care of them. Because my infection might be mild, but if I'm actually transmitting the infection to an old age, plus 65, it can be dangerous, it can be fatal.
Yes.
And we don't like any household to have this actually burden on their shoulders to infect a member of the family itself. And another point which is very important for anyone even taking their medications and not controlled. So if a patient who is diabetic uncontrolled, he's a normal person. But if it's not controlled, if a hypertensive not controlled, they need to be very cautious if they got any infected person in the family. And during entering a very crowded place, we're talking about public transportations, we are talking about airports, especially airports, because it's actually prone to the major outbreaks, because you got all nationalities in a very small place and a very poor air circulation.
Yes. Of course. What are the other variants of the COVID-19?
So currently we do have 2 types of variants. We got the variants of concerns, and in the table of the World Health Organization we got only 1 variant there, which is JN1, and it continues year after from 2023, 4 and 5, we got it as a variant of concern. For the variant under monitoring we do have 7 variants. So currently we do have 8 variants circulating worldwide. But the most important, as I was saying, it doesn't matter the infection is caused by which variant. So anyone got infected with COVID, it doesn't matter to ask whether it is that variant or this variant, because the treatment will be the same.
Yes.
And we got a decline in the JN1, which is the most vicious one. And the most circulating one currently is what we are talking currently, the XFG
Yes.
stratus. And the stratus one is actually so far mild, but just take care, because we've seen it a lot. Once someone from the household got the infection, all the household will get it. It's
Yes.
highly spread.
Yes. Doctor, actually, we're always afraid about the people who are suffering from chronic disease, our relatives, friends, neighbors. So what is the effect of the new variant on the people suffering from chronic diseases?
That's another good question, because the hospitalization currently and the surge happening in Europe and in Asia is actually mostly among old age and mostly among chronic disease patients. We're talking about, and this is very important, uncontrolled diabetic and uncontrolled hypertensive. Patients who are actually under control of medications and they got a stable condition, they are normal people. Because when the virus actually infects an uncontrolled NCD, non-communicable disease patient, like hypertension, like diabetes, like cancer, they are actually hitting on their immunity system. And most of them will have a moderate to severe symptoms, and we are not currently talking about the normal respiratory symptoms. We're talking about the lower respiratory system infection, which is severe. We're talking about decrease in the oxygen level in the blood. We're talking about distress and even breathing. And these symptoms, they require medical consultation and they require hospital admission at the spot. But usually, if they got actually admitted early, there is no fatalities, because when we're talking, this is very important about fatalities and mortality, we don't have an increase in terms of percentage, we have an increase in terms of number.
Yes.
But this is because of the increase in circulation, of course.
Doctor, what are the precautions that we should take to avoid the viruses like this?
So we do have two things. If a healthy person would like to protect himself or herself from getting the infection, the most important thing currently is actually taking care when entering a crowded places.
Yes.
Public transportation, and when meeting people at work, if it's crowded, we can return back to mask. We don't have the culture of mask, and facial masks are very important. If we can just make a transfer of the culture from the Asian countries, they wear masks everywhere, every wave.
In the elevators especially. The elevators.
Yes, especially elevators, especially crowded places, especially in the street. And second is to take care of my immunity. And taking care of the immunity, it means I have a good sleep, eating healthy, I'm away from
What are the
carbs and
kind
fats.
of things that we should do, the things that we should eat, the sport that we should perform in order to raise our immunity?
So in terms of food, we're talking about good nutrition. It's not a diet, a strict diet, but just to avoid unhealthy, to avoid junk food, fast food as much as possible. To avoid actually eating carbs and fats a lot, eating a lot of vegetables. We need to have a lot of colors in our food, vegetables and fruits all over the day. We are in the summer, we're lucky we have in Egypt beautiful and tasty fruits. We can actually eat as much as possible, and just small quantities. And also about the sleep is very important, to have a good time sleep, as well as drinking a lot of water. Avoiding tobacco smoking, avoiding any type of smoking, which is cigarettes, electronic cigarettes. They are the same, by the way.
Yes.
And most important, it's very easy said and very difficult to do, is to avoid stress. It's very hard, of course,
yes,
but
of course,
we'll
the
try
stress.
to do it.
Also the smoking, as you've just mentioned, because this is something that comes in the respiratory system, isn't it?
Exactly.
Yes.
So the early days of COVID, there was a rumor that smokers, they don't catch COVID. That's completely false. That's completely false. Smokers are more prone to taking the infection, and the probability is actually higher.
Yes.
And because they have weaker lungs, and if the infection is actually in the lower chest, it will be very dangerous for smokers. So they need to avoid that. Another point, just for people who got infected, they need to make sure they are not infecting others. So we should just adopt a good public health culture that we don't shake hands. We don't kiss in the morning if I got an infection, for example.
Yes, of course.
And we don't need to be actually embarrassed that we're not doing that.
Yes.
So it should be embedded in our culture, maybe embedded in the education for school children, to make sure that I don't infect other people. This is very important.
Yes. Dr. Anan, for more than 100 years now, in the year actually, specifically in 1924, Egypt started the vaccine of TB.
Yes.
And all the Egyptians take the TB. On the contrary, European countries or foreign countries, it's not obligatory. So give us an idea about the importance of this. Does this act have avoided many
Some COVID infections
to catch, or 60% of the people to catch?
So anyone born before 1981, they got the mark, the shoulder mark?
Yes.
Okay. And this is a protection mark.
Yes.
So we got higher protection rate than Gen Z, for example, and the rest of millennials in catching COVID. And currently we do have a lot of studies concerning that. It increases the immunity towards viruses in general, specifically for corona family, which is SARS, MERS, and COVID-19. So having said that, the lucky people, the 1981 and before, they need as well to take care of something else, because they will have a mild infection.
Yes.
But they can transmit the infection to another person, and it will be moderate to severe infection. So it's very important to mention, it's not necessarily because someone got a mild infection, he will be transmitting a mild infection.
Yes.
A mild infection can transmit a severe one.
Yes, yes. But actually, the flu itself, it could, after this, transfer to pneumonia. And pneumonia is killing, no? So it's dangerous. Yes, give us an idea about this, because pneumonia, when the stage reaches to pneumonia, it's the
pulmonary distress and pneumonia. It's very actually dangerous, because most of fatalities,
especially for elder people.
Yes, 65 plus, and that's why, for example, there is a recent study done by the Ministry of Health here in Egypt concerning the cost of illness and the burden of having flu among old age.
Yes. And
because old age and people with chronic conditions, they need to take flu shots. And the flu shots is actually very important for many reasons. Talking about COVID, it's very important to avoid having flu when it's actually a COVID season, to make sure that what I have now is COVID, not, for example, flu, so and avoid confusion. Another point is it can deteriorate the lung health, as you mentioned. If it reaches pneumonia, it can reach a very decreased level of oxygen. Sometimes they are put on oxygen, and it's actually, I don't want to use the word vegetated, but unfortunately sometimes we reach that state in the ICU. So we need to avoid that as much as possible. The paper published last year with the Ministry of Health was actually highlighting that people above 65 and with chronic conditions are very important to take influenza vaccine.
Yes.
It's very important to make sure.
But which kind of the vaccine? Because the flu has several types.
Yeah, so every year, it's a good point. We do have currently 2 types available in Egypt, coming from 2 different multinational companies. And every year, they need to change the vaccine, because we do have a seasonal flu. And the vaccine that was actually used in 2024 cannot be used in 2025. What we used this year, we're not going to be actually used in 2026. So every year, we need to get new batches.
Yes.
And this is a sophistication of the flu vaccine, because you need to make sure that you do have a good forecast of the quantities you're going to be using in the country, make a pre-order in the mid-year, and then receive it before the flu season, which is during October. So after we finish this summer season and the COVID wave, we will be starting, unfortunately, the flu season.
Yes.
And it's very important to start the flu season with it, because if the flu season started and you take the shot after that, it's not going to be as effective. The important thing about the vaccine for COVID, for example, and for flu is actually 2 things. It's not about preventing the infection from scratch. It's about decreasing the rate of hospitalization for people who are going to be admitted if they are not taking the vaccine. And another point is to decrease mortality. So whether we are talking about flu vaccine or we are talking about the COVID vaccine, both they decrease mortality. One of them will decrease it by 90%, the other was 80%, and it will decrease admission in the hospital. But
Yes.
for infection, it doesn't matter. It doesn't matter if someone got a mild infection during vaccine.
Yes.
But at least they're not going to be deteriorating his health.
Yes. I thank you very much for your time. Thank you for coming today. We really had the pleasure to host
My
you
absolute
today. Thank you
pleasure.
thank you so much, Dr. Islam Anan, Health Policy and Health Economics Consultant. I really had the honor to have you with us today.
My
Thank
pleasure.
you.
Thank you.
Well, ladies and gentlemen, a short break, and we are going to be back with you for our second topic.